Good afternoon. What does a homeless person look like to you? What does this person do? What does this person wear? How do they behave? Is it someone who panhandles? Or someone who sleeps on a park bench? Or someone who eats their meals at a soup kitchen and lives in an emergency shelter? Who among us is homeless? Do you know anybody who's homeless? Do we even know what it means to be homeless? Or what to even do about it? A homeless person is defined by the U.S. Department of Housing and Urban Development as a person who sleeps in a place not meant for human habitation, such as living on the streets, a safe haven, or living in an emergency shelter. There are varying kinds of homelessness, such as those that are temporarily homeless. They may have fallen on hard times, living paycheck to paycheck, losing a job, or needing temporary assistance. There's also those that are episodically homeless, those that shuttle in and out of homelessness and may have short shelter stays over a couple of years. But my main concern has to do with those that are chronically homeless. HUD defines a chronically homeless person as a person who has a disabling condition, who has continuously been homeless for at least 12 months, or who has had 4 episodes of homelessness over a 3-year period where those episodes combine up to 12 months. The chronically homeless population represents 10% of the total population, total homeless population. These individuals are often entrenched in the system. They're often older, they have disabilities, and they also have mental health issues and substance abuse addictions that prevent them from entering into housing without any kind of subsidized social services. Although this population of the chronically homeless represent 10%, they use half of the resources provided to the homeless, according to researchers Dennis Culhane and Randall Kuhn. There are many factors that go into why someone is homeless. And although there is these factors in homelessness, the traditional approach has done little to improve this situation. This traditional approach, often called the treatment-first approach, requires individuals to go through a series of prerequisites in order to receive services, such as psychiatric stability, abstinence, clean criminal record, and following an intensive service plan that demonstrates readiness from emergency sheltering into transitional housing. These folks that follow this traditional approach are often going in and out of homelessness, from shelter to back onto the streets. And many of them have chronic medical and mental health issues that they deal with every day that prevent them from staying out of homelessness. Think about this for a second. What if you were somebody who had a mental illness or had a substance abuse addiction, or even somebody who simply is trying to get back on their feet, maybe getting a GED, getting a job, or someone who's trying to set themselves on a course towards independence and self-sufficiency? How can you achieve those goals if you live in a shelter with 50 or 100 or 200 different men, women, and children or families, many of whom you may not even know? Or how can you achieve those goals if you live under a viaduct, or you sleep out in the cold and the snow, the rain, and the elements, or you sleep on a park bench? This approach has been going on for a while, is not safe, it's not stable, and it's frankly not smart. The housing first model, through the creation of permanent supportive housing, does not require prerequisites for services or any conditions for treatment. A person is housed first. Advocates like myself believe that housing is a right, a fundamental human right, and not a privilege to be earned. This particular traditional approach prolongs homelessness and continues to deprive people of this basic fundamental right. Housing first. Housing first is not a one-size-fits-all approach. There are many arrangements and different types, ranging from single individuals to large families. But housing first is very client-centered that focuses on providing permanent supportive housing that is safe, that is stable for individuals and families, while providing ongoing, flexible, wraparound community supportive services. Folks that advocate for housing first know that it is an important thing towards ending chronic homelessness. A study done in a capstone project by students in the Master of Public Administration program at the University of Southern Indiana identified that the number one reason why someone self-identified as homeless was because of the lack of affordable housing. Evansville's recently reported point-in-time count, which is done every fourth week of January during the coldest weeks of the year, counted 427 unique individuals who were homeless. 55 of those are chronically homeless. Of those 427 homeless, 109 of them identified that the series of mental health issues was one of the main reasons why they were homeless. An IHC, a study by the Indiana Housing Community Development Authority, noted that there were 2,230 unique instances of homelessness in Evansville each year. Some of our community's most amazing advocates, supporters, and leaders of this Housing First movement are right here in our community. Through work through individuals, groups such as Aurora and Echo Housing Corporation. Evansville has 6 permanent supportive housing facilities, totaling 140 units. 20 of those are at Lucas Place. 27 of them are at Lucas Place 2 for veterans. And this facility, Vision 1505, which is a partnership between Aurora and Evansville Housing Authority, has 32 permanent supportive housing units with 2, 3, and 4 bedroom units. Permanent supportive housing is a need in this community. Echo Housing Corporation's newest project, Garvin Lofts, slated to be opened in January, will add 40 additional permanent supportive housing units to our community. 12 of those units are set aside for those individuals experiencing the greatest medical vulnerability. Through the study of Indiana Housing Community Development Authority I mentioned, they also cite that Evansville, Indiana today is in need of 150 new permanent supportive housing units. Housing First, permanent supportive housing, provides an effective solution. Even though our homeless rate hasn't gone up, the need for permanent supportive housing has not gone away. Housing First. Through local homeless service agencies, in partnership, the Commission on Homelessness for Evansville and Vanderburgh County work with these agencies to end and prevent homelessness in our community. One such program is one that started earlier this year, called the Evansville Network of Diversion, or END. Diversion is a system-wide collaborative effort that's very client-centered, that connects clients to services, provide financial assistance, and divert people away from shelters, where shelter often being a last resort. My friends, what is the cost of doing nothing? Or what is the cost of continuing to go down this traditional path of dealing with the chronically homeless? Those individuals and families who don't receive permanent supportive housing are often passed on to social service agencies, jails, hospitals, healthcare, mental health facilities. They're often lost in the system, and it ends up costing more to the system than using the Housing First model. A study done by the University of Southern Indiana Center for Applied Research for the Indiana Housing and Community Development Authority found that permanent supportive housing provided public cost savings of $1,149 per person per year. Housing First. In this study, we show that 76% reported a decrease in domestic violence. 69% reported an increase in school attendance for their children. 63% reported better relationships with their family members. 53% reported an increase in community involvement. while in permanent supportive housing, while 58% reported that the conditions of their neighborhood were better as a result of permanent supportive housing. Housing first. The results are undeniable. Some quotes and voices from our study. My health has been restored since I've been here. I was so worried about other things that I didn't care about taking care of my health. Another voice, I have better self-worth now. I want to keep this place to live and enjoy. Housing first. My friends, homelessness is a problem that can be fixed. It's simply not one that should be relegated to the invisible bowels of our society. We can do a lot to end homelessness and solve the problem. But in order to effectively end chronic homelessness, we need to simply do more than just give $1 or $2 to a panhandler, especially if that person isn't even homeless. Volunteering at a shelter is a start. It allows you to see and feel the face of homelessness. Raise money for low-income, affordable, permanent housing. Advocate for permanent supportive housing to politicians and policymakers on the state and local level. Donate to local homeless service providers. Advocate for permanent supportive housing to these folks, to our leaders, and impress upon them that permanent supportive housing is cost effective and it yields greater cost savings and even improves the quality of life of the residents who live in there than simply doing it the old way. Housing first, my friends, can put us on a path to end homelessness. Housing first can transform lives and transform communities. Won't you be a part of the transformation? Thank you.